Why addiction is a disease and not a choice. Hi, my name is Obi, a nurse who is passionate about mental health and addiction recovery. Today, I'll be talking about a topic that is actually being misunderstood by so many people: addiction. Comment down below if addiction is a disease or a choice. A lot of people still believe addiction is as a result of low moral failing or a series of bad choices or a result of low moral standard. But as a nurse and someone who sees this every day, I can tell you for a fact that this is not the case. In this video, we'll explore the science behind addiction, why it is classified as a disease, and how this understanding can change the way we treat people struggling with this condition. What is addiction? Addiction is a chronic disease of the brain that affects the way the brain processes reward, stress, and self-control. What do we understand by the brain reward system? The brain reward system is a network of regions and pathways that regulate pleasure, motivation, and learning. And this system uses neurotransmitters like dopamine to create pleasurable sensation and motivation. According to the American Society of Addiction Medicine, addiction is a primary chronic disease of the brain reward, motivation, and memory, and not just about bad behavior. Like other chronic illnesses, such as diabetes and hypertension, addiction requires ongoing treatment and care, not punishment or shame. What happens in the brain? Addictive substances like opioids, alcohol, nicotine hijacks the brain dopamine system, and over time, the brain rewires itself to crave that substance just to feel normal. The brain becomes less responsive to everyday pleasure. This is why people can't just stop. Their brain chemistry has changed. And just like someone with asthma and cancer needs medical support, so does someone with addiction. Let me give you an example of myself. My addiction wasn't as a result of any of the substance use disorder. No. Mine was more like watching TV. Watching TV. Yes. When I was in the university, when I was in college, I actually would not study. I would not study without turning on my TV. I must listen to noise to be able to study. Over time, I found out that I could not just study on my own. There wasn't any motivation to study until I watch movies, until I hear the noise. I don't enjoy music when studying, but I enjoy that noise from a TV, that movie, those actions, to study. I begin to realize within myself. I begin to think, I was like, this is not supposed to be. I am getting too addicted to this. And then, as at that time, my brain has rewired itself that no, I will not get pleasure from studying. I will not get pleasure from reading my book without watching TV. But when I realized, I had to say to myself, you need to stop this. I consciously started withdrawing myself away from screen. And today I can tell you that I have been able to overcome this. Yes, I have been able to overcome this. The role of genetics, trauma, and environment. Addiction does not happen in a vacuum. Genetics, childhood trauma, and environmental stressors all play a role in this particular condition. Studies have shown that nearly 50% of the risk of addiction is genetic. Many people living with addiction also struggles with underlying mental health conditions like depression, PTSD, and or anxiety. As a nurse, we don't ask why the condition started. We ask, what's happened to you? That question leads to healing. When we ask what's happened to you, it leads to healing. But when we try to question, how does it start? How did you get involved? At the end of the day, the person or the patient withdraws. Why does this perspective matters? When we understand addiction as a disease, we replace judgment with compassion and empathy. We stop blaming and we start supporting. We focus on treatment, not judgment. We promote trauma-informed care, meeting people where they are, recognizing their worth, and believing in recovery. And this is the role of healthcare professionals: to educate, to advocate, and to treat with dignity. If you know someone you love is struggling with addiction, please know it is not a character flaw. It is not weakness. It is a health condition, and help is available. Help is available. If anybody you know, anyone you know, or anyone you even love is struggling with this condition, please know it is not a character flaw. It is not a weakness. Help is available. On this channel, I will continue sharing evidence-based, compassionate content on mental health condition, care, on mental health and addiction care from a nurse who truly cares. So hit the subscribe button, share this with someone who needs to hear it, and drop a comment if this message spoke to you. Thank you. I will see you in my next one.